Now to going over to our next panelist, Dr. Kedar. Yeah, very important doctor, lung. Everybody are hearing and worrying about lung. So here's the doctor here.
Thank you, Rupashri, for the kind introduction. Can people see my screen? I just wanted to confirm that.
Yes, sir.
Yes. Okay. So the topic for today is what to do when you turn positive, and that's really my topic for the day. I thank SIRC, the wing of the ICAI, for calling me to talk this very important topic. My Lavanya, who actually recommended that I should be one of the panelists on this. Thank Mr. Kota Srinivas Jalpati and also Mr. Changal Reddy, who actually introduced me earlier in this particular program. I'm going to talk very, very quickly. Part of it, Lavanya has already covered. Some of the questions Rupashri just asked also are part of the talk that I am giving. Though, my talk is just on what to do when you turn positive. I'm also utilizing this talk to make it a very pictorial kind of a talk. So this is something that I had saved a lot of photographs for. When the post-COVID era happens, we can look back at it and, wonder about all the forwards and stuff like that have gone on. So the most negative word of 2020 and of course 2021 in the situation that we find today, where Bangalore is probably the COVID-19 capital of the country, is the word positive. And what's happened in this year that has gone by? We had a mysterious illness start out at the end of 2019, when in March, the World Health Organization declared this to be a pandemic. The world shut down. There was a lot of talk about flattening the curve. There was a lot of mental health, issues that people came up with. But yes, there was hope in the form of vaccination, but also the hopes were shattered because of new mutations. And as we enter 2021 and we are in the middle of it, we find ourselves really struggling and grappling, especially in our country. What we saw in the first pandemic is in the first wave in United States and Italy is what we are finding ourselves in the second wave. And we are really trying to grapple with both resources, manpower, medications, and so on and so forth, and also handling all the complications. So the second wave, what really are our problems and why are we struggling so much? And the reason why we are struggling is because of the speed at which this has inundated us. This is nothing less than a cyclone which has really taken us by storm, and it's really devastated us to the extent that we are trying to grapple ourselves back onto our feet. And our biggest problem has been our numbers. We are probably 4 Americas put together, and therefore it is really very difficult for us to grapple with this kind of numbers when we are trying to handle the problems. And these two have been our biggest problems. Compounding those problems is the fear that coronavirus has created when it started out. And also there is so much information out there that people are completely confused. The scientific community is also confused. There is a retraction of papers. Never probably in the history of medical literature, we've had so many papers fall into this particular category with conflicting data, retractions, and so on and so forth, that we are struggling to make sense out of what is getting published day in and day out. Lavanya has already covered this particular slide on all the COVID-19 symptoms: fevers, chills, cough, shortness of breath. However, this is COVID-19 is just like any other flu. But yes, there are a few unique things that the loss of smell and taste is pretty unique to COVID-19. In the second wave, what I've observed, is that patients are grappling with fever, and it is not remitting despite adequate treatment. The other problem that some people tend to face a lot is diarrhea, and some of them, despite good therapies, are finding it very difficult to control. So what happens when you turn really symptomatic? And when you turn symptomatic, the first thing you do is isolate. The second thing you do is isolate. And the third thing you do is isolate yourself. The moment you see any sign of the list of the symptoms that I listed in the last slide, the most important thing is for you to isolate. And I think this has been our biggest problems. You can tell a dog to sit and stay, but it is very, very difficult for us to sit and stay in one particular place. And what basically happens in COVID, this is the timeline of what basically happens. you get exposed to a person who's probably COVID positive, and then what basically happens is you tend to incubate the virus, and before even you turn symptomatic is the time when you are infective to others. So about 4 days from when you turn positive or when you turn symptomatic is when you're actually shedding the virus, and it can continue for up to 10 days, 7 to 10 days. Literature varies on this, where you can be infective to other people. And this is really what is the problem. So there is an asymptomatic phase and there is a symptomatic phase, and the asymptomatics, picking these group of people is becoming the problem, because that's when the infection is getting spread the most. And this is really what is the biggest problem. The more contagious you are, the lesser sick you are. So you are most contagious when you are least sick, and that's really another problem. This is another graphic showing the same kind of thing, where you tend to get picked up by the test around the 4th day from when your symptoms starts. So testing too early is a problem. Test rate is another problem, and finding the right balance is a bit of an issue. But what we suggest is, the moment you're symptomatic, you should go ahead and test, isolate yourself first, and go ahead and test yourself second. And what is the typical progression of COVID-19? So this is basically happened with this in the last presentation. So you have an incubation period of about 2 to 14 days, with an average being 5. That's when the symptoms start arriving, and you may have no symptoms at all in some cases. 15% of the ones who get infected out of the whole group are the ones who end up in severe cases. I would rather put it as 10% into moderate and 5 into severe or very severe category, who require hospital admission, oxygenation, ICU care, and so on and so forth. But our problem is not the 5%. The 5% still continues to remain. It's our population which is the denominator, which is creating the biggest problem for us, because we are grappling with numbers. We are grappling with a unprepared health infrastructure at this particular point in time. How do you test? Basically, there are 3 standard tests: RT-PCR, the antigen testing, and the TrueNat. And all of these tests are about 60 to 70% in that range, where they give you a good response. What is important, however, is to remember this particular thing. And I have a lot of problem with people who test by one method and then say that and then believe that the test was not done right and go to another method. Basically, what you're doing is wasting resources. So if you're positive by any one of the methods, do not retest. And if you are negative, there is always a possibility that the sample was not taken properly, and there's always a possibility you tested too early, and so therefore you may have to retest yourself. So suppose you test positive by any method, I'm repeating it, please do not retest. And suppose you test negative, please continue your isolation and repeat your test about 3 or 4 days after having tested negative. And what do you do when you test positive? And in the last wave, when we tested positive, everybody was supposed to be hospitalized. There was supposed to be 2 negative tests within 24 hours for you to be discharged from a hospital facility. A lot of it has been taken off, both because of the numbers and our better understanding of COVID-19. What you do now is you stay at home, you get rest, and you stay well hydrated. Get in touch with your doctor these days, and you don't always have to get in touch with specialists. Every doctor these days is updating himself or herself and treating COVID-19 to the best of his or her abilities. And however, the most important thing is to isolate yourself, not just from others, but also from your family members. So what are the things you do? You basically move away 6 feet. In most of the instances, if you had to, usually isolate yourself to a room, but if you had to use common areas for whatever reason, maintain a 6 feet distance, use your cough etiquette, and Lavanya dealt with it in her, previous talk. Please try not to go outside of your house, but if you had to go out, it has to be only to the hospital, and always cover your mask, your nose and your mouth. Try not to touch your nose and your mouth. Frequently disinfect yourself and wash your hands often. And these are all standard. Our understanding of COVID-19 has significantly changed from what we understood it a little earlier. And what we now understand is that COVID-19's transmission is heavily airborne, and it's aerosol, which is the main mode of transmission. For a very long time, we did believe that it was the surface spread, and therefore there was a lot of importance giving to surface spraying and cleaning surfaces and so on, while we are not ruling that out. But having said that, we now understand that the major or the larger burden of transmission is basically airborne or the aerosol mode. So what do you do when you're basically at home? So the first thing you do is you monitor your saturations, your heart rate and your temperature, and you do this thrice daily, which is what is the standard recommendation. But you tend to do more, or you can go ahead and monitor yourself more often, if your symptoms tend to be progressive. Use a triple layered mask only when you open the door. In your own room, in the confines of your isolation, you do not have to wear a mask and sit all the time. But suppose you had to open your door, take your food, talk to somebody, or you're keeping your door open to communicate with people, maintain the 6 feet distance, but you not and then usually use a mask. Seek medical advice, stay well hydrated, do light exercises in your room, and eat healthy. Frequently wash hands. I've already spoken about it. Open the windows for better ventilation. Utensils are recommended not to be shared. I this later, but staying in isolation has its own set of problems. So read books, do the things that you always wanted to, watch TV, talk to family members. But most importantly, if you have comorbid conditions in the past, whether it's diabetes, hypertension, or you are hypothyroid and you're taking medications, please continue to take it in addition to what your physician has recommended for the illnesses. One important aspect is about saturations. A lot of people tend not to measure it very properly. And what is important for you to understand is to sit very calmly in a place for about 3 to 4 minutes, put on the pulse oximeter, wait for the pulse oximeter's reading to stabilize. A lot of people come running, put on the pulse oximeter, find their saturations low, or have their heart rates very, very high, and then panic, and then try to call everyone out there. And I've received many, many such panic calls. So it is very important for you to measure this right and record it right. It is important every single day to record your temperature, your heart rate, and your sessions accurately to the best of your abilities. And also remember, market is today flooded with loads and loads of pulse oximeters, and we don't know how many of them are really good, how many of them are ISO certified and meet the standards at this point in time. It's also about the numbers that we are talking about, and so it's inundated in the market. The next question is, when you are positive, you are at home, you are isolated, when is the time, or what are the red flags that you should look out for hospitalization? Continuing to worsen on the symptoms, and when you start developing worsening cough or shortness of breath, a saturation of less than 94 on room air, and I would say recorded at least an hour apart twice, temperatures continuously recorded for more than 100 degrees Fahrenheit for about 3 days, 2 to 3 days, and if the doctor has elevated inflammatory markers twice that from what is actually normal for that particular lab. There's also a lot of talk about CT scans and recent controversies. I'm sure a lot of people would have seen that. What I want to insist and tell you guys is that there is no role for CT scans in mild disease. It is a lot of unnecessary radiation, and it does not in any way contribute to your care. Every single investigation that a doctor asks is extremely important, and it should contribute to make a change in your care or establish a baseline. A CT scan in mild disease does not do that, and therefore is not really very, very helpful. And what are the situations it's likely to be helpful in then? So if you have a negative RT-PCR report and the suspicion of COVID-19 is very, very strong, that's one of the indications where you can consider a CT scan. The symptoms are rapidly progressing and your RT-PCR is awaited. Today, it's not like you order for an RT-PCR and tomorrow or in a few hours you have the RT-PCR available. Of course, a lot of point of care tests are getting more readily available, but we still are having a large backlog. It takes about a day or sometimes even 2 days for the RT-PCR report to come back. And therefore, this is a situation where you have rapidly progressive symptoms. You could consider a CT scan. And of course, in moderate to severe disease, yes, a CT scan is recommended. It assesses the severity of the disease. It assesses if there's a superadded infection. It helps the doctors decide on treatment escalation and also helps us in assessing complications. Let's get to the next part of my talk, where I'm talking very, very briefly about medications. And I must say, we've always been willing to truly consider evidence that contradicts beliefs and admit the possibility that we may be wrong. But yet, the medical literature is so much flooded today with papers, some claiming that it is useful, some claiming that it is not. It is very important to challenge ourselves to know if we are doing right and relook at the evidence often. So this is just what is available, and everything was glorified at one point in time and then was taken off the shelves, and that's created a lot of confusion in the minds of many people. And what really works in COVID, this is the entire list of medications, and there is a lot more which is not included. Of course, the one in red, there is definitely no evidence for any of this. Azithromycin, vitamins, favipiravir, ivermectin. Ivermectin was thrown out by the World Health Organization quite some time back, and we still continue to have it on some of our protocols. HCQS, oseltamivir, and even plasma therapy is out now. What really benefits at this point in time is blood thinners. We know that patients who are hospitalized develop clots because of their decreased movement, and we also understand that COVID is a prothrombotic state. Remdesivir, again, remdesivir was thought of as a miracle. It does not cure one of COVID, but decreases hospitalization and the symptomatology. Steroids, yes, of course, and that's probably why a lot of people tend to, hoard it. That is the only one showing some degree of survival benefit. And a recent Lancet paper has shown a budesonide doing very well for patients with respiratory, symptoms, and therefore has now been on routine mild care, protocols. Of course, there's a lot of discussion on availability, complications, and problems with itolizumab, tocilizumab, newer drugs like tofacitinib and baricitinib. And these days, I get every 2 or 4 queries every day on availability of the new drug by the DRDO, the 2-DEGE. So this is basically what it is. What I want people to understand is it's not available as yet freely in the market. The trials have gone on, and I think they've just been wrapped up. Basically, the mechanism is to starve the coronavirus of its energy, thereby killing it. That's really what we know as of now. The trial data is not yet out, but it's likely to come in soon, and it's likely to be available more widely soon. So going to the aspect of treatment, we really saw a bunch of treatments which is full. And really what is important is to go minimalistic in this situation. What you really need in mild disease is just symptomatic therapies. If you have fever, paracetamol. If you have some cough and sneezing and so on and so forth, antihistaminic, a cough syrup to soothe you. A lot of hydration is important, and just eat normal diet. What happens when you are in the moderate or the severe group? Please let your physician decide. We all go through things very differently. Every person is different, and every person's treatment has to be tailored very differently. So let the physician decide. One size does not fit everybody. Mental health, Apurva Rajshekar is going to cover this a little later. So I'm not going to go too much into the details. She's a psychologist, and I'm pretty sure she's going to discuss all of these aspects. What is important, however, Lavanya too highlighted a few points: light media consumption, avoid discussions too much about COVID. Remember, maybe, hopefully, in a year or so, we will, think that COVID is history and life will go on. Build resilience with people you love, keep things in perspective, have a plan, and seek professional help. A lot of people ask me, doctor, in what way can we contribute? And this is something which is very close to my heart, and I call this section How to Save the World. And this is really something that is very important. We tend not to mask ourselves well, and this is very important. Lavanya spoke about this very earlier. It is important to cover both your nose and your mouth while you mask yourself. And what I believe is important is science should stop analyzing animal intelligence, and we should start studying human stupidity. You can go down your street and you can see so many people covering their mouths but not their nose. What is the use of doing that if you're not doing it effectively? And this is something that is there. We don't have to put numbers, but if you do put in numbers here, this will speak for yourself. If 2 people are unmasked, the probability of the other person getting the disease is very high, while one person who is not infected, is at the other receiving end. There is still a high incidence. If the person who is infected masks himself, there is medium. And that's why I said, if you are going to open your door while in isolation, please ensure that you're masking yourself. And if both of them are vaccinated, the incidence is probably the lowest. So treat your mask like an underwear. This is something very interesting. Do not touch or adjust it often in public. Do not borrow or lend your masks. Make sure the fit is tight and comfortable. Make sure it is clean. Wear it the right side out. If it is damp, please change it. And of course, the most important thing is do not wear your mask. Don't go commando. There's a lot of discussion in the newspapers and a lot of talk these days about double masking. Again, there are ways how you go about double masking. Double masking can reduce COVID-19 transmission for up to 96%. And what is important is to wear a disposable mask underneath a cloth mask. Do not combine two surgical masks to be your double masking. And do not use N95s to mask. The second part after masking, if you want to save the world, is by vaccination. And we had this very interesting photograph circulate during, the vaccine available, not available phase or just available phase. And then there was a lot of discussion about how it is from one political party by human trials are not. The anti-vaxxers and the fence-sitters had really a ball of time at this particular point in time. What we understand, once this phase went off and we had 2 vaccines available in our country, we really had another problem, which is better. And there was a lot of discussion about this is 60% and this is 62% and that is 65% effective. But what is important for you to understand is this is just like the paradox of the Buridan's ass, where the donkey is both equally thirsty and hungry, and it can't choose between the two and therefore ends up dying. So what is important for you to understand is whether it is Covishield or Covaxin, just take your jab. That's really what is important. Don't worry about the numbers. What is important is to get vaccinated. And remember, it is not getting yourself vaccinated. Getting as many people vaccinated around you is actually what makes the greatest impact. I'm sure a lot of people would have read recently about how the US and the CDC has now brought in recommendation of not being masked if you are double vaccinated. So that's really what can happen if you are able to get to that level. But yes, US has been really on the job. In the 5 months that they had the vaccines, they vaccinated as many people, and we are yet to get there. But this is what the impact can be if we get our vaccinations. Yes, there's a lot of talk about the duration. And so now the government is talking about 12 to 16 weeks. A lot of people do think this is political, but there is scientific data to say that when you increase the gap between 2 vaccine doses, it is far more effective, because the first vaccine dose gives you a good lot of antibodies, which will take some time to wane, and by which time you can take the second vaccine, and therefore you have a sustained antibody response, thereby giving you a better antibody levels to sustain any kind of a virus threat. Of course, the Covaxin is also known to have good neutralizing titers against the newer variants. But yes, these are all what the companies talk about. What I would still go by and recommend very strongly is please vaccinate yourself, vaccinate the people around you, and talk about vaccination and get everybody whom you can and influence them to vaccinate if that's really what you can do. And what really do vaccines do? We definitely know this. Why are we having many more younger people come in today with COVID is because a large elderly population seems to have been vaccinated. And probably the hypothesis is that's really why we're seeing the people who are coming out doing the daily working are coming out of the lockdown to do the things who are getting more affected. So basically what vaccine does is it brings down the disease severity. So this is really what is very, very important. And of course, a lot of stuff is going on WhatsApp about the ideal, duration between 2 jabs. But yes, there is hope. The situation will ease. There will be more stock soon, probably in the next 3 weeks or so. We already understand that Sputnik 5 is out. Dr. Reddy's is manufacturing about 40 million doses soon. There is authorization of the vaccine for more than 12 years now, and hopefully India as well. And of course, there is a lot of talk about intellectual property right waiver for vaccines and for a lot of the technology that has gone on with COVID. And there is a worldwide movement. And hopefully, if this materializes, we will see a lot more come up. There was some question earlier on the third wave, and really, this is the answer to it. How is that the tree is still standing, said the tiny dragon? During better times, said the big panda, it grew deep roots. Now it can weather any storm. A third wave is at this moment a very big speculation. And so was the second wave, and we never expected it. At least I did not think that the second wave would inundate us with the kind of stuff that it has. The third wave, to my mind, again, is a probability. But yes, looking at what happened to us in the second wave, we should be better prepared. And that's really what is important. Whether the third wave prediction comes true or not is completely out of our what we can really understand. But what is important is we can utilize the next 3 or 5 months that we have to vaccinate as many people as possible and get our health infrastructure and the medications to the levels that may be required if and when the third wave hits, and we hopefully should not have one. I think Rupashri asked this question to Lavanya, and yes, there are some reports of zoo animals, especially tigers, which turn positive, and cats and dogs are reportedly infected with COVID-19, especially in close contact. However, what is important to understand is the risk of animals spreading COVID-19 to people is considered very low. However, what precautions one can take is do not let your pets interact with people outside the household. And if a person is positive and you have a pet at home, try to isolate the pet apart from the person who is turned positive. I get a lot of questions about smoking and alcohol. Can we have a drink, sir? And so on and so forth. Of course, we understand that smoking is really bad and it can worsen your COVID-19. Alcohol, I would just say there is no recommendation or there are no trials, but social drinking would probably be fine. But do not go overdose on it because you are depressed and you are at home and overdo things. So what are the strict no's? We've done this, and all of us we have probably been in this place, but I think this is really what is very important. I would say hoarding is one of the biggest things that we should not do. We hoarded HCQS in the initial days of this pandemic. Essential supplies were off the shelf. Today, steroids are in short supply. The oxygen concentrators are now getting hoarded by apartment complexes in the anticipation that people may get ill in the apartment and they would need infrastructure and backup. I am really not for this particular hoarding. Repeating tests for confirmation is another strict no. Doing a CT scan very early is another no. Alternative therapies and home remedies. A lot of questions get asked, grandmas, dawai, this, that, and so on and so forth. You can do it in addition, but again, let me tell you very, very firmly, there is no evidence for it. And of course, there are some smart ones out there who are now talking about the third vaccine dose. They tend to do an antibody titer, they find it low, and then they want to get their third vaccine dose. Please remember, this is not taking us anywhere. We can all go out there together and see how this goes. There is no guideline we have yet on the third vaccine dose. And therefore, I think the ones who've got the second dose must understand there are people who are not vaccinated with the first dose. So the third vaccine dose is akin to hoarding, number one. Number two, there is no guideline on what it can do if you end up getting the third dose. What helps? Of course, what helps really is to keep fear at bay. I think one of the things that has driven many of the things on the strict no list is this fear. I think it's the fear that we fought, the fear of death, the fear of contacting COVID, the fear of being separated, the fear of isolation that's really created the problem. I think a little common sense helps. Yes, Lavanya has already told you the statistics. 80 to 85% people have mild illness and they get away with it. And it is very important to have common sense and just be mindful of what you do. And a lot of problems can be solved. And the most important thing is to act responsibly. Before I end my talk, I leave you with a couple of thoughts. What is important is we have gone through a lot in the last year and a half. Let's turn our pain into power, our sadness into strength, our wounds into wisdom. Let's not waste the pain and let's recycle our heart and make it the greatest comeback we ever can. And let me leave you with a thought. Nothing has ever lasted forever. And I hope that COVID too will not last forever. Thank you, ladies and gentlemen, for the patient hearing.
Yeah. That was a wonderful presentation. I think even before I can ask questions, everything you have answered. That's how it is. But still, there is, and I like the amount of pets which you have used to depict what you're saying. I think this will take the message across more easily to the people. There's one important question, like we are talking about people having this nebulization at homes. So how frequently they should have and how good it is on your lungs?
Okay, so I was talking about budesonide a little earlier in my talk. There's a recent Lancet paper which has actually shown that an 800 microgram dosing given twice a day is pretty effective, especially including for those in mild symptoms. Now, budesonide can be given both via an inhaler with a spacer, and it can also be given via nebulization. Now, what we have traditionally found is it's just ease, and some people tend to find a nebulizer more easier because they already have it at home. But what we also know is when you nebulize, you tend to aerosolize a lot of virus because you are opening your mouth to inhale it, and therefore you can tend to aerosolize. So in 90% of the situations, if the person is not very elderly, if the patient is completely, bedridden, he can use an inhaler and a spacer. My strong recommendation is to try and use an inhaler with a spacer rather than go for a nebulization of the same medication. These are just two delivery ways of giving the medication. So please choose an inhaler with a nebulizer, inhaler with a spacer rather than a nebulizer to take the medication.
This can be done as a preventive, even though you don't have COVID on a regular
No,
basis.
no, there is no medication at this point we're recommending as for prevention at all. And what we are saying is for mild disease with patients with respiratory symptoms, budesonide is very, very useful. If you look at all the guidelines right now, the recent ones which have come from AIIMS and even some of the protocols of hospitals, you can always see that budesonide is now recommended as part of mild therapy.
And doctor, one more thing, everybody are worried about their kids. So that, what is it in store for them? Vaccine, the nasal vaccine or anything that is really going to come up very fast?
We've actually, I've covered very, very briefly about it. And I've actually told you that at this point in time, there are, of course, concerns. People will not want to enroll too many people, and there will be some concerns about going through the trial. At this point in time, we have an emergency use authorization for greater than 12 years, not in India, but yes, abroad. Likely we will follow soon the suit. Bharat Biotech is also taking a lot of steps in this regard, and we hope to see some kind of data out in the next coming days. I can't say that this may be applicable to kids of all ages, but at this point in time, certainly there is some hope for children above the age of 12.
Yeah, thanks a lot, doctor.